Do you ever feel like you are being held hostage by drug companies? All too often, people are made to believe that they have no options when it comes to taking a drug. If your doctor says you need a drug for a serious health problem, you might think it is the only thing you can do. You may feel frightened at the prospect of going against your doctor's recommendations. You may be wary of seeking out natural alternatives. Drug safety is becoming a major concern among many health professionals. Reports to the FDA of serious adverse drug events, including deaths, have more than doubled in recent years. This is more than enough reason to do a little of your own research and explore natural alternatives before you get that prescription filled. Learn about the harmful side effects associated with the drug. Also, seek out some secondary advice. Research whether the risks outweigh the benefits. Consider what lifestyle changes you could make to improve your health. And investigate some natural alternatives, which may help you avoid taking prescription drugs. Here are some drugs with clinically proven natural alternatives worth trying. Number 1. Fosamax versus calcium and vitamin D. Fosamax is an osteoporosis drug called a bisphosphonate. It works by inhibiting the work of osteoclasts. These are the bone cells that break down and remove old bone. It has a long list of possible side effects. Such side effects include stomach ulcers and osteonecrosis, or death of the jawbone, resulting in tooth loss, pain, and infection. Calcium and vitamin D are natural alternatives that can help prevent your bones from reaching the point where you need Fosamax. Long-term calcium supplementation decreases primary fracture rates by 30% to 35% for vertebral bone. It also decreases these rates by 25% for hip bone. It is estimated that 30 years of continuous calcium supplementation after menopause might result in a 10% improvement in bone mineral density. It is also predicted to result in 50% overall reduction in fracture rates, compared with women who do not take calcium supplements. Vitamin D is just as vital. Its major functions are to maintain serum calcium within a normal range, enhance intestinal absorption of calcium and stimulate stem cells to become new bone-building osteoblasts. What to take: 1,000 mg of calcium, and 1,000 to 2,000 IU of vitamin D. Pair these natural alternatives with a multivitamin containing magnesium, boron, copper, zinc, and other nutrients essential for bone growth. Get vitamin K from leafy greens or a supplement. It revs up bone-building cells. Number 2. Prozac versus fish oil. Prozac is a popular antidepressant. It is a SSRI, serotonin reuptake inhibitor. This means it helps to keep the happy neurotransmitter, serotonin, floating around in your brain longer. Fish oil is a win-win for anyone with depression. It can work by itself for some people. It also can safely help antidepressants work better. It gets incorporated into cell membranes, making them more fluid and responsive to the neurotransmitters that latch onto the cell's receptor sites. Population studies show people who eat more fish have a lower risk of depression and suicide. What to take: at least 3,000 mg a day of fish oil. Up to 9,000 mg of fish oil per day has been used in studies to treat depression. It can take several months to see an improvement in symptoms. Number 3. Donnatal versus peppermint oil. Donnatal is prescribed for irritable bowel syndrome. It is an antispasmodic, so it relieves pain and cramping. Side effects include constipation and decreased sweating, dizziness, drowsiness, and dry mouth. Peppermint oil is one of the major natural alternatives that has long been used to soothe cranky tummies. It decreases gastrointestinal smooth muscle spasms. Plus, peppermint oil can reduce abdominal pain and distension and flatulence. It also decreases diarrhea in 70% to 80% of patients. People with irritable bowel syndrome often find relief by increasing their intake of soluble fiber as well, and using probiotics for bloating and abdominal pain. What to take: 0.2 to 0.4 ml of peppermint oil before meals. Also, get 20 to 30 grams a day of fiber from diet and supplements such as psyllium. Into these natural alternatives, take a good probiotic that contains at least 3 billion CFU. Number 4. Benadryl versus Quercetin. Benadryl is a brand name for diphenhydramine. It is an antihistamine used to treat hay fever and other nasal allergies. It works by blocking receptor sites for histamine. This is the biochemical that causes the runny nose and scratchy eyes. These receptor sites are found on the cells in your nose, eyes, and lungs. The drug's main side effect is sleepiness. In fact, it is also used in over-the-counter sleep aids. Benadryl has also been linked to possibly increasing your risk for dementia. A compound found in many plants, quercetin is considered a natural antihistamine. As a natural antihistamine, quercetin can inhibit release of histamine from certain immune cells. Evidence suggests quercetin inhibits antigen-stimulated histamine release from mast cells of patients with hay fever. It's also a powerful anti-inflammatory. What to take: 300 to 600 mg 3 times daily. Along with 2 helpers, the natural alternatives bromelain and vitamin C. Number 5. Glucophage versus cinnamon. Glucophage is a diabetes drug. It increases insulin sensitivity. It also improves the sensitivity of insulin receptor sites on cells. The drug makes it easier for them to pick up insulin. This lowers blood glucose levels. The most common side effects include indigestion, headache, and diarrhea. Research suggests cinnamon also improves insulin sensitivity. It makes receptor sites on cells pick up insulin better. One type of cinnamon in particular, cassia cinnamon, can lower fasting blood glucose by 18% to 30%. Researchers have also found taking cinnamon extract can lead to significant increases in lean body mass. Also, cinnamon can reduce overall body fat. Additionally, cinnamon has antioxidant properties. These characteristics can fight aging. Plus, they can help your heart. What to take: 250 mg in the morning and evening of a water-soluble cinnamon extract. This extract is more absorbable and safer than consuming large amounts of powdered cinnamon. Don't let your doctor, or pharmaceutical ads, talk you into taking a drug you may not need before you have a chance to try to improve your through natural alternatives. It takes courage to turn away from the simple drug solutions that are so prevalent in our current way of thinking about medical problems.